I have taken this theory into a serious strategic research activity, and I have looked into what has happened in the Arabian Peninsula and the Arabian population when they pass through this very huge change in the lifestyle. Now imagine if your grandfathers are passing through a famine state, their genetic setup is sending a signals to your body to store as much as you can from energy in the form of fat. So what happens then when you are off the famine phase and passing through a wealthy type of phase,
an abundant,
where you have a lot of diet and less exercise? This is what have made obesity, not only diabetes, but also the other chronic complications very, very commonly. And the GCC countries, 3 of the GCC countries are one of the top 10 countries when it comes to diabetes prevalence.
And I think
I had summarized it for you.
I think it can be very easy and quite lazy thing to say, oh, it's because, the population eats too much fast food. So thank you for shedding a light on the history. And, we think about genetics being a couple of generations, but actually, as you say, historically, going from a famine state to an abundance and the physiological changes that happens, in those bodies in the short term, but in the long term as well. So I wanted to ask then about that piece about the past, present, and I guess the future of diabetes and the education in the GCC countries. Do you feel like conversations have changed, certainly in your time as the Director of Research and Scientific Centre?
I think the main change, what has happened in the Arabian Peninsula and the GCC countries, have been when we look into diabetes, had occurred between the 70s and 80s, and have accelerated in 90s and the 2000s. And now we are in an era we are not sure, are we really going up or flattening or even coming down? I think those countries have to really take things very serious. I'll give you an example of Saudi Arabia. In 1985, the prevalence of diabetes in the kingdom is 5%. 10 years after, jumps to 12%. Another 10 years have jumped to almost 24%.
Wow.
Now, if you look at how much doubling, we are talking about an incidence rate of almost 1%, which means every 10 years, the prevalence of the disease is increasing by almost 10%. Keep in mind also that diabetes is a disease of old age, and the population is aging. So this will add on to what has happened. Now, if you look into how much these countries have done in diabetes prevention programs, I think there has been very, very limited programs that can really stop this tremendous shock GCC countries are really facing with this disease.
Well, it's kind of twofold, isn't it? It comes from the medical community and government to an extent, but it's also the personal responsibility of people to educate themselves about their health and making those lifestyle changes, whether that is, through diet and exercise or indeed getting medication that they might need. So I wondered if perhaps if I was to make you, ruler of healthcare for the GCC region, what kind of, implementations, programs, personal responsibility would you love to see put in place to, if not turn things around, but certainly start to flatten the curve of diabetes increase in the region?
I think I would start from the earlier age. I think I will put a lot of weight on school education, mass educations of the young people. At the same time, also education of the adults and the whole community. I think we have to promote a healthy life. And we mean by the healthy life is basically a reasonable calorie intake with a reasonable good physical activity. Those are the two things we can really play with and have shown from different societies that they do really have an effect and they can reduce the prevalence rate. At the same time, to help those two wings, if you would like to say, I would also change some rules and regulations in those countries. The type of food served to the people, the compositions, the way of cultural attitude to food and so on. Well, one of the other problems which we face in the GCC countries, which is not the case in other societies, is the Arabian culture. We are a culture by which we express our our how would they say we express our feelings in the food. So if you invite anybody, you cannot really limit it to a dish. You have to bring a whole lamb, and you can really understand the problem. Yeah.
That's
So
an
we have to
amazing
change
point.
the culture. We have to educate them. At the same time, rules and regulations at the governmental level and young people education is really a mandate.
I wanted to ask you, if you don't mind, Professor, to get a little bit scientific. Why are some people secreting more insulin, yet they've got high blood pressure, high blood sugar, rather? Would you mind explaining that to us?
Yeah, yeah, thank you very much. This is something which is always being asked, and a lot of people are really confused in this. Now, let me give you the explanation. Your pancreas, you are born with certain number of islet cell of Langerhans, which is responsible for insulin secretion. They live with you. You lose some of them, but what is remaining for you, even when you become old, is enough for you to metabolize your glucose. Now, your body, your genetics is really expressed in your pancreas. Your pancreas knows exactly what your body should be to really prepare the insulin needed. So it's just like a kitchen which is preparing a food. So now imagine that you have increased your weight. So your body mass index, let's say, moved from 24 to 30. What does this mean? This means that you are now hosting a lot of adipose tissue inside your body where the pancreas doesn't know about it and not equipped to really take care of it. So this is why the poor kitchen is now trying to really come up with a quite good volume of insulin to try to overcome this problem. Now, there is a stage when this pancreas gets exhausted and the blood sugar is really increasing with time. And this is when the high insulin is there, at the same time the glucose is there, which doesn't make sense in people mind. But if you look at it in this way, you understand. And the real diabetes started when the strike of the pancreas take place. Here, the patient will start noticing that he starts to lose weight, his blood sugar shooting up, and his insulin is now coming down. So they passed into the phase that the kitchen is really clearly saying, I cannot serve you anymore, and you have to look for somebody from outside to help you with the
We
insulin.
need more
As simple as
resources.
that. Yeah.
Professor, I wanted to ask you then a little bit about being pre-diabetic, because we've got diabetes numbers to an extent in the region, but a huge number of people are pre-diabetic, pre-insulin resistant, and don't even know. And we think about a lot of people finally getting the help they need, finally getting into the doctor's surgery, or indeed taking action themselves to reverse diabetes once it gets to quite an advanced stage. And I wondered if we can talk a little bit about prevention, so people aren't having to go on meds necessarily, or indeed have any kind of interventions. So to everyone listening today who has not had a diagnosis of diabetes, who perhaps there isn't a family history and they're tuned into the fact they might be pre-diabetic, what do you think we should be doing to future-proof our health in this area?
Okay, good. Let me start by saying that generally, in any community, you should have 50% of the total diabetic population as a pre-diabetic. But for example, since we are talking about GCC countries, imagine for each diabetic patients, there is a pre-diabetic in the GCC countries.
Wow.
Which means that we are double pre-diabetic than what is known internationally.
Mm-hmm.
This goes back to the same famine theory and the thrifty gene I have told you, and the obesity. Now, if you want to really minimize the disease, you have to really look for primary prevention programs, which works mainly on the pre-diabetic people.
Mm-hmm.
Now, the problem with the pre-diabetic people, that they are not known. So you have to screen them and bring them to life, so at least you can visualize them and you can put management. The good things about those pre-diabetics that you can very easily put them back to normal stage, either by changing their behavior, lifestyle, dietary, physical activity, and sometimes with drugs. Now there is very good drugs that can really do a lot of effect in regressing the disease and bringing back patients from being pre-diabetic into normal phase. So this group, if we hammer really strongly and put a very good primary prevention program for them, I think we can see some sort of flattening and then regression of the incidence of the disease.
Professor, can I ask you lastly, do you believe that obesity is a disease?
Yeah, that's really a good question. Thank you very much. Let me go to the Arabian culture. Do you know that obesity in the old age, in the old time, is part of beauty?
Really?
And yes, and if you go to the Arabic literature, obesity is something healthy. It's not disease. Now, this have been taken in our mind also until this moment. People does not really look at obesity as a disease. Honestly, yes, it is a disease, because there has been a lot of studies which have shown that the more you store fat cells, the more you increase the number of fat cells, the more inflammatory process you are going to have. And studies have shown that even if you are not diabetic, you could have ischemic heart disease. You could even insult your liver, and you go into what we call fatty liver, and all these diseases that can eventually sometimes even carry very high mortality and also morbidity.
Yeah, and all those comorbidities as well, when we think about how they can feed
That's
into
true.
things like cancer and heart disease as well. We are going to be exploring the topic of weight loss drugs next. But in the meantime, Dr. Khalid, thank you so much. I really appreciate your time. It was a history lesson and some insights in the medical world as well. Dr. Khalid Alrubeaan, the Director of Research and Scientific Centre at Abdulaziz Humanitarian City. Wishing you a very happy and healthy 2024, Doctor. Thank you so much.
Thank you. Thank you very much. Thank you very much.
So do stay tuned. We are going to be talking about what some are calling a bit of a controversial subject, but some are saying an absolute game changer in the world of health and healthcare: weight loss drugs. That's next.
By I 103.8.
Join the conversation.